Hi, my name's Rob, and today I'm going to talk about Parkinson's. So, as you probably know, Parkinson's is a neurodegenerative disease, and it affects motor neurons. So, you might know from famous people like Michael J. Fox or Muhammad Ali that Parkinson's affects your ability to move your body. It also has other effects as well. So, Parkinson's can cause jerky movements, and it can cause inability to move smoothly, and it can affect how people walk. So, the research in Parkinson's is focusing mostly on dopamine. So they found that people with Parkinson's actually don't produce dopamine like normal people do. And so, as you probably know, we have neurons that function to transmit brain signals or our thoughts when our thoughts tell our muscles to move. So if you look at my hands, with Parkinson's patients, let's say this is two neurons, we have a gap between them called the synapse. And Parkinson's patients have this accumulation of sort of junk protein that clogs up the synapse here, and this impulse that needs to go across to say, move this muscle, doesn't go across because it's sort of a roadblock there. Now we found that the junk that's in the middle is something called alpha-synuclein. It's a protein involved with the membranes of cells, but it needs to be degraded properly. So a lot of the research in Parkinson's is actually looking at alpha-synuclein and trying to figure out, okay, normal people who don't have Parkinson's, they create alpha-synuclein and it has a positive function, but their body has signaling pathways that degrade alpha-synuclein. So how can we get Parkinson's patients to actually degrade alpha-synuclein? So that's a lot of the research. And so there's been some latest therapies in this treatment using nanoparticles, which, as you might know, are very, very small, nano-sized particles of different elements that behave differently than their normal elements. So, for example, aluminum is not explosive, but aluminum at nano size is explosive. So when you change things to nano size, they have different properties. So with aluminum is not involved with the treatment of Parkinson's, but some of the new treatments are using nanoparticles to deliver dopamine directly to the brain by bypassing the blood-brain barrier. So nanoparticles can help in drug delivery and get things across areas and get things through areas where they normally wouldn't go. As well, there are other delivery systems targeting proteins within the cell through genetic methods, and new research also shows promise in mapping the brain circuits to understand how the loss of these the loss of these neurons actually takes place. So hopefully in the future someday we'll have a treatment, and if not a cure, for Parkinson's. Thank you.